Great. Well, good evening, everyone. Hopefully you can hear me. I am delighted to be here with you this evening and be the MC for tonight's event. We really are so glad you could come join us. It's been a long year and a half, and it's really been very brutal to our society. But it's been wonderful now to have an opportunity for us to meet safely in this location and get together and talk and connect with friends and colleagues, and hopefully some new people that you can meet as well. That's a really important function of an event like today, is the networking. So we'd like to begin by thanking you for your cooperation with our safety protocols. We really waited a long time for this opportunity, and it's great that we can begin. Hopefully you've had a chance as part of this event to make the most of this opportunity, perhaps take a photo on the red carpet, and please consider sharing your photos with the hashtag shown on the screen in front of you. We'd also like to extend a heartfelt thanks to the University City Science Center for welcoming us to this lovely space here at the Quorum. We'd like to thank them for helping to introduce the eBook and this very exciting community that we have an opportunity to work together on building. And I think the location, the proximity of this space is really very valuable. And it really attests to the important innovation work that the University Science Center does with its critical stakeholders, the work that it does educating innovators and facilitating innovation to help make Philadelphia really a very exciting and important hub in the region for developing innovation. I'd also like to thank my other co-authors, co-editors on the book, Dr. Flora Winston and Rachel McGarrigle. I want to say thank you also to the leadership at CHOP and Penn ITMAT for the support they've shown this really important endeavor. So I'd like to just sort of begin by saying that the impetus for this effort really began many years ago. One fateful day, Dr. Maher called me into her office and said, hey, would you be interested in helping to teach a class, MTR 620? And I said, that sounds awesome, and I'd love to be involved with that. And as part of that effort, what I realized was that we didn't really have a textbook that was the groundstone for teaching this important content. I looked around, I really couldn't find anything that seemed to fit the bill. And so slowly over the years, thanks to the help of dedicated individuals like yourselves and many other talented students, we've been able to amass that critical knowledge and really put together the skill set that's needed to create this. One important thing that we always thought about as we were working on this initiative is the importance of creating an open source tool. And the reason why that's so valuable is that we really felt that equity and inclusion are key values that we wanted to embody in putting this effort together. And that's especially important because we live in an era where we appreciate increasingly the importance of diversity and diverse opinions in helping to launch new initiatives. Those diverse opinions really help to make sure that anything that is put together is inclusive and doesn't leave out groups that have a valuable input to share. We also believe it's crucial to create a healthy ecosystem for the individual innovator. And the different opportunities that exist are very, very valuable in this regard. Innovators need this support so that they can flourish, so that they can find the nourishment and sustenance, so that their ideas do not fade away, but can instead prosper. Together, I believe we've made a very important step in creating that foundation to support this effort. You have helped contribute by creating an open access resource that offers tools, advice, and best practice guidelines that people around the world are looking at. There have been over 40,000 downloads of the content from this book throughout the world, India, Australia, Africa. And that really attests to the power of these platforms that offer open access resources. This is curated, thoughtful content that you have put together that is really state-of-the-art in a very dynamic field that is constantly changing. It's been an amazing learning journey for myself and my other colleagues who've been part of this effort. And I always remind myself that I'm very honored and humbled by the opportunity to be both a teacher and a student. So I've learned as much from you as perhaps you might have learned from me along this journey. We're very excited to be now transitioning to the Pub platform, and you'll be hearing more about that from Dr. Catherine Ahern, because this platform allows us to create an interactive community, really leveraging the power of this new technology. We've done some market research, talking with different stakeholders, trying to understand how best we can adapt the content to meet these needs. And I think you'll really be excited by some of the opportunities this new platform offers. As your MC tonight, I'll be introducing you to the different people who have been pivotal in transforming this initial idea into this 600-page collection of thoughtful advice and information. That includes my co-editor, Flora Winston, and the Knowledge Futures, Dr. Catherine Ahern. And this also would not have been possible without the support of ITMAT Education. So we're very fortunate to have Dr. Maura Maher here speaking on the importance of the training, the workplace of the future. For right now, though, I'd like to begin by introducing Saul Bihar to welcome you to this beautiful space and introduce the Science Center.
Thank you, Nalika, and good evening, everyone. I'm Saul Bihar, General Counsel and Senior Vice President of Strategic Initiatives here at the University City Science Center. On behalf of Tiffany Wilson, our President and CEO, and the entire Science Center team, I'm delighted to welcome you to our Quorum event space. I've been at the Science Center since 2009, and so I've had plenty of opportunities to see firsthand how critical academic research is to the healthcare and technology solutions of tomorrow. It takes bold ideas and a willingness to think beyond the status quo to overcome some of our biggest healthcare challenges. For close to 60 years, the Science Center has operated at the intersection of healthcare, technology commercialization, and economic development. Today, the Science Center advances healthcare innovation from idea to marketplace through providing services to academics and entrepreneurs, allocating capital, gathering the innovation community, and building inclusive STEM pathways for Philadelphia youth and adults. It's no secret that the Philadelphia region, with its outstanding talent, as evidenced by everyone in this room, is a leader in biomedical discovery. The Science Center is fortunate to have partnerships with more than 40 academic and research institutions across Pennsylvania, New Jersey, and Delaware. Among those valued partners, of course, are CHOP and Penn, both of whom we've had the privilege of working alongside in a number of ways, including through our QED Proof of Concept program for academic researchers. In addition, we've collaborated with CHOP scientists and staff on our firsthand STEM education programming for Philadelphia middle and high school students. Together with institutions like Penn and CHOP, we're ensuring that promising technology isn't left on the bench and that youth from all backgrounds have exposure and access to STEM careers. On behalf of all of us at the Science Center, we're thrilled to have another touch point with CHOP and Penn today as we host your event that focuses on academic entrepreneurship, a topic that's near and dear to us. And we hope that you'll consider the Science Center as a resource beyond today's event. In addition to our commercialization programs, we offer other programs and events through our Quorum initiative that are designed to connect innovators with the resources and people needed to grow their business or pursue an idea. And we also host our free Venture Cafe Thursday gatherings, open to the innovation ecosystem and the wider community. Those gatherings take place each week from 3 to 8 p.m. on Thursdays. Thank you again. I hope to see you back here soon.
All right, so I'm looking forward very much to introducing our next speaker, Dr. Flora Winston. Dr. Winston is a friend and colleague who's really been instrumental in helping to put together this effort and support this, and we really wouldn't be where we are without her dedication and passion for this topic. She wears many hats here at the University of Pennsylvania. She works both in helping to lead the innovation ecosystem effort at Children's Hospital, and she's also a practicing pediatrician. She's also got her finger in the startup space and has been very active in those activities and has really been a leadership figure in helping to promote child safety. So I would please join me in welcoming my good friend and colleague, Dr. Flora Winston. Thank you.
I have to say, it's been a labor of love working with Nalika on this and with Rachel and the rest of the team and all the authors, because there's been this problem over a long period of time that people don't know how to take their great science and turn it into commercialization. And when it comes to children, it's even more difficult. So this is a wonderful picture that really gives a sense of why we are the Children's Hospital of Philadelphia, and we're thrilled that our new CSO, Sue Firth, is here leading the charge for innovation. The isolette. How many of you have had a baby that had to be in an isolette? It came from CHOP, the 1930s. This is where it started. In fact, The first hospital for children in the United States was on Bainbridge Street, down the street, 1855. We have been innovating for children for years, but things got more complicated. It wasn't enough for us to just have babies in isolettes. We had premature babies, right? We had very premature babies. And so just recently, we actually spun out a company to try to start thinking about, what do we do if they're very premature? Can we have an artificial womb? Can we do things? These kinds of efforts come not easily for children. And that's what I really want to talk about today and why this is so important. In 2006, the Institute of Medicine, I'm part of that organization, came up with a book about safe devices for children. They are not small adults, okay? They need their own devices. And in 2006, they said, we need this, right? We are now in 2021, and we still aren't developing them. We still can't figure this out. 67% of the reason why is because of the cost of development. It's so expensive, and they're a small market. So we've got to get more efficient. And that's what this is all about. It's about building capacity, building connections, building a culture and pathways to get people to be able to develop devices for children from all of our great discoveries. Billions of dollars of investment in research never makes it to the bedside. And we need to do that, or doesn't make it to prevention. So this is what we call in engineering, I'm an engineer as well as a pediatrician, the valley of death between research and commercialization. And we, all of us together, are this light that's the bridge that's really guiding the future to get our research into devices and therapies and cures for our kids. So what's the formula for making this happen? Of course, you need the rigor. You need the degree. You need to have the great science. That's not enough. It's necessary, but insufficient to actually have something that's going to save a child's life. You need to connect. You need culture. You need capacity. And that's what we're all doing together. We're building that. We're starting this community with this e-learning book, with the community that we're building, because tomorrow your effort is going to save some child's life. So that's what it's all about, is helping these kids have a future, giving them the promise of not having to worry that their disease is going to keep them from reaching their full potential. This is why we're doing it. And that's why I was motivated and so thrilled that Nalika let me join him. So I hope that you can join us and be part of the community.
I think what Flora mentioned really highlights the urgency of this effort and how there really is no time to lose. And that's why the role that we play as educators is so valuable. With that, I'm looking forward also to introducing my friend and colleague, Dr. Emma Maher. Dr. Maher is the Vice Dean and Chief Clinical Research Officer at the University of Pennsylvania and the Associate Dean of the Perlman School of Medicine Master's and Certificate Programs. She also directs the ITMAT Education Program, and that program has been a very committed and supportive aspect of helping to put this book together. I had the opportunity to meet Dr. Maher almost 20 years ago when she helped give me very valuable advice on getting my first K-23 grant. I still remember her redlining that grant. And that was good advice because it got funded somehow. All right, so with that, I'll turn the speaker over to Dr. Maher. Thank you. Thanks.
Well, good evening, everybody. It's a pleasure to be here this evening. It's my first public event in whatever number of months. It feels a little strange. I've got more adrenaline in my system than I would normally do with public speaking. So thank you for showing up. I'd like to tell you a little story. I came to the US in 1994. I knew nothing about research. And I had an interview with my department chair at the time, Ed Holmes. And he said to me, there are 3 things that will make you successful in academia. The first is 2 R01s and a PPG. The second is a clinical practice. And the third is a reputation as an educator. I looked at him and said, well, that sounds wonderful. I left. The person who was actually hiring me said, how did that go? And I said, I'm not too sure. He used lots of acronyms that I didn't understand, but that I was going to give it my best shot. I tell you that story in part because there are a lot of people who are a lot younger than me in this room. what it takes to be successful in improving the healthcare of the people who we take care of is dedication, vision, and today, this sense of being entrepreneurial. When I met Nalika 20 years ago, I actually don't remember redlining that grant. I was probably equally scared of the advice that I was giving him as he was about submitting that advice. So that would be my second take-home message that I would say to you, is by speaking with each other, learning from each other, you will be remarkably surprised at how the advice you garner and the advice you share helps to create a community. So what we have today is the result of whatever number of years work that is from 1994, when I realized what I didn't know and designed a program to teach myself what I didn't know, has turned into what we call today ITNAT education. This is a very, very large education program funded by the NIH that involves a lot of people. Nalika is one of our associate directors, and I'm delighted to see Rachel Bastian and Megan Maxwell in the audience today. They are two of my partners in crime in making this education happen. We look for talented people, undergraduates, graduate students, postgraduate students, people out in the workforce and junior faculty. And we ask them, what do you want to become? And then we design an education curriculum around that activity. And over the last 10 years, our focus on entrepreneurship has increased exponentially. So when we think about the domains in which we educate the workforce of the future, they're depicted on this slide. We have mounds of data. We don't quite know what to do with a lot of this data. We talk about a learning healthcare system, and the fundamental informational unit of a learning healthcare system is data that we derive from the patients that we take care of. Informatics and bioinformatical tools are essential to creating that workforce. We also know that we need to bring new products to market, just like you heard about just a few moments ago. Whether they're devices or drugs, we need to understand what is the regulatory framework necessary to bring those products to market. So we train people on how to do that. Discovery is this concept of fundamental principles and basic science that are translational into the human model. And so we treat the application of discovery science into clinical investigation. And then the one that is relevant here this evening is that of entrepreneurial science. And as I think about how successful we have been in this area, it is in very large part because of the investment of CHOP. Many years ago, CHOP agreed to invest in what was called the Entrepreneurial Science Scholars. They funded 5 senior trainees within the CHOP educational system to engage in an entrepreneurial science project with a view to commercialization. Nalika led that particular track within the MSTR program, our Masters of Translational Science, and proved to both the CHOP community as well as the Penn community is that we could train these skills, an essential set of skills to develop a workforce, both within academia as well as outside of academia, that is able to take course concepts and deliver them into a product that can be used to improve the outcomes of our patients. And I will leave you with one final thought. And this thought is for those of you who maybe are earlier in your career. You have many challenges that you face. The pandemic has certainly highlighted for us how difficult it is to do good science and how important networks and communities are for you to feel supported and to feel successful. The pandemic also emphasized that underrepresented populations have a higher rate of attrition from science than others. The attrition of women from science is scary. So as you think about the competing demands and interests in your everyday lives, it's your families, it's your work, it's your spirit of innovation, it's your community, but very importantly, it's your own sense of self. And those of us who are a little more aged in the community, whether we like to admit it or not, our responsibility is to mentor, advise, and support to ensure that the next generation of workforce in this area of bringing products to market is supported, and they will be successful long after we've gone. Thank you for the opportunity. I'd like to congratulate Nalika. I have watched him and Rachel and Flora bring this ebook to life. It has extended way beyond the borders of this physical campus and is impacting individuals not only in the US and abroad. What you have done is truly remarkable. It's my complete honor and pleasure to call Nalika, Rachel, and Flora my colleagues. Thanks very much.
Thank you very much, Emma. Thank you so much for your kind words and also helping put this in context. And I think that this aspect of mentorship is really one that is often underappreciated, but really crucial for many of us. And I really encourage each of us to, try to seek those opportunities, both for our own personal development and to enrich others. Thank you for sharing that. So now we've learned a bit about why we prepared the book and how you could possibly use it. Next, I'd like to introduce Dr. Catherine Ahern, who can tell us how we can use this book in terms of creating a community and some of the future potential this effort that you've contributed to can help achieve. She is the head of content for Knowledge Futures. It's a nonprofit organization that we researched, we explored a variety of different options, and Knowledge Futures really stood out for the unique offering and potential that it provided. The platform is called PubPub, and she will now explain a bit more about it and the potential it offers. Dr. Catherine Ahern, thank you for joining us.
Hello, everyone. Thank you so much for inviting me here today. And I'm just honored to be part of the speakers. And I'm just really appreciative of the partnership that we really, fostered around this book. Once again, my name is Catherine Ahern, and I am the head of content for the Knowledge Futures Group. Just for a little bit of background and context, the KFG started as a nonprofit. It started as a joint partnership between the MIT Press and the MIT Media Lab. In March of 2020, really an awesome time to start anything new, we spun out as our own nonprofit and now operate as a 501c3. One of our products is PubPub, which is the platform that this book is now published on. And PubPub is a completely open source platform for open access publishing. Anyone can create a community on PubPub at any time. And at this point, we have lots of different types of publications on there. So people use it for more traditional monographs and journals. They also use it for conferences, multimedia learning resources. Really, we find new stuff on there all the time. Right now, it has over 3,000 communities and 45,000 users. And a small portion of those have come about from partnerships that we've cultivated with people to really carefully create and cultivate communities or networks of communities around content. And this is a perfect example of one of those. There we go. So KFG's involvement in this is really both technical and content focused. When I first saw Nalika's dazzling matrix of spreadsheets and links in Google Docs, I knew that a big mission was, it was dazzling. I knew a big part of our mission was to channel all of that into an interface and platform that students could really engage with and easily use to enhance their learning and understanding, but also that the authors and editors could use to inform their teaching, their writing, their revision, and even future projects. So with this edition, an author can directly update themselves the chapters that they've written as new information becomes available or as they advance their research. To minimize trolling on the platform, we do require that in order to comment, annotate, create your own content, that you create an account and agree to our terms of service. But anything published on the platform itself is open and free for anyone to actually read. You can engage with the text by highlighting passages to annotate them. You can embed media in your annotations so that you can, communicate beyond text. So we've had people embed videos, podcasts as part of the feedback that they've given. You can also use these chapters in your courses as open educational resources. And I encourage you to encourage your students to also go in and annotate and comment either, in response to their own thoughts or other things that, that people have said. I've seen professors seed chapters with their own questions and comments for students to react to. And I've seen students interact with each other to really bring their discussions beyond the classroom. You can also download chapters, including as PDFs, which I know people still really love. But I do encourage you to, make the most here, because it's how we cultivate a community around ideas. It's how you engage in conversation with people, and it's how we advance these ideas as well. I'm happy to go into more. There's a lot more to say, but I want to keep it short. I know I'm the last speaker in an event that's many of our first parties in a long time, but please come find me. I'm happy to brainstorm, hear your ideas, answer your questions. And again, thank you very much for having me.
Thank you very much. And we're very excited about the potential the platform offers, and we continue to explore its learning potential and opportunities. So I'd like to thank all of our speakers. And I think that it really kind of highlights the potential that exists here in our system to really help accelerate and advance this space. I'd also like to thank all of you for taking time out of your valuable day to come join us, and hopefully you can continue to benefit from this event by enjoying some of the food, but even more important, meeting some of your fellow authors and colleagues who are also committed to this space as well. That opportunity is really valuable, especially in these times. I'd also like to extend our sincere thanks to the CHOP Research Institute, Dr. Sufert and colleagues, for all their help in supporting this important initiative. And IFMAT Education, Dr. Maura Maher, as mentioned earlier, has been really supportive as well. This event would not be possible without a lot of hard work from members, Vicky Bartak, who did a phenomenal job, Suzanne Hill, who's really been like the engine of getting this moving forward, and we're very grateful for all her hard work. Jesse Stover and Amelia are helping us a lot as well. Natalie Oppenheimer has been very helpful, and Christy Norris and Madeline Smith and Pat Harris have also contributed so much. And it just really kind of draws to light how by all of us working together, we can create these kind of special events and opportunities. So many thanks for joining us and for listening to some of the potential. So just a couple of photos from the red carpet. This is all Suzanne's idea, so she's the guilty party here. Thank you very much for thinking about that. So again, please take a moment to have a photo of yourself and enjoy the evening and the camaraderie. Thanks so much for coming out. Thank you.